Hi, this is Lisa Miller, and I wanted to talk with everyone about an area of benchmarking that I find very concerning that I'm seeing more and more in the industry. And it's actually misleading hospitals to either think that they don't have opportunities for cost savings in indirect or purchase services spend, or to feel like they have an opportunity and they go in and dig deeper and there's no opportunity, but maybe this tool has given some insights and they've made some commitments based on thinking they have opportunities. And so I'm reading more and more, I'm hearing more and more about ratio benchmarking. Yesterday, I read an article, 10 ways supply chains can use analytics to access greater savings on indirect spend. And they talk about in this article ratio benchmarking. It says ratio benchmarking reveals opportunities for your organization to dig deeper into particular categories. So ratio benchmarking typically picks a denominator. The most common denominator we're seeing is bed size. So whatever that particular purchase services or indirect spend is, that total spend, dividing it by that denominator, which is typically bed size. And so the concerning part of this, and it even states this in the article, is that it reveals opportunities for your organization to dig deeper into particular categories. So we say ratio benchmarking or any kind of broad benchmarking, it gives you false negatives, false positives. Just go to your invoices, get your invoices, look at those line item details, and utilize a provider that can give you purchase services or indirect spend benchmarking, line item detail spend benchmarking. So the problem is that you want to put purchase services into a nice tidy box and be able to say, okay, we're going to benchmark your spend for you in an easy way. And I'm here to tell you there's no easy way to benchmark purchase services spend. It is the roll up your sleeves category that you cannot fit into a tidy box. It requires going into your line item detail spend, looking at historical data by line item. And so the big problem is, and I'm going to give an example today, is first of all, which bed size is it? Is it Medicare licensed bed, is it certified beds, or it's staff beds? What's that data coming in? What is that denominator? So for the purpose of today, we've utilized 3 hospitals we have data for. We've blinded the data. It's Hospital A, Hospital M, and Hospital B, and we've utilized staff beds. And we have dialysis total annual spend. And we did the ratio benchmarking by staff bed. And I also put in the actual one-to-one rates, the largest line item spend for dialysis. And there's a couple other factors, very important factors. But for the purposes of this demonstration, I put in the one-to-one rates. So it was interesting because Hospital A has an annual dialysis spend of $1.2 million, and they have 269 beds. Their ratio benchmarking, the dialysis spend by bed size, was the highest at $4,461, yet they had the best one-to-one rate. The second hospital had 306 beds with a total dialysis spend of $696,000. Their ratio benchmarking bed size by total spend was $2,275. And their one-to-one rate, if you benchmark in the industry, had a 20+% opportunity. If you were looking at ratio benchmarking and you said, wow, we have a $2,275 price per bed size for our dialysis, they had that best ratio. And so someone would say, and I've seen it, they have the dots and they go below the averages. You don't have an opportunity here, when in fact, that's false. There is an opportunity. Now, there's a lot to be discussed about competition and other factors with dialysis. But I want to bring to everyone's attention, if you are in any way, shape, form, ratio benchmarking your rates by bed size, net patient revenue, it is a very dangerous approach. And when I say dangerous, you're going to miss opportunities. And for hospitals today, missing cost savings opportunities is dangerous. You want to capture all of these cost savings opportunities. The absolute best way, the optimal way, the high-performing way of benchmarking is invoice line item details. Benchmarking those invoice line item details to peers, to competition, and utilizing a company like VIE, who we go right to the invoices. We don't give you ratios so that you have to dig deeper. We dig deeper right away, and we give you those opportunities. So if you're relying on some of those ratio benchmarks and you're seeing some categories where it says there's no opportunity, you need to look at those invoices, because in fact, there could be opportunities that ratio benchmarking is missing. And I've had discussions with supply chain executives who have said they've brought some of this benchmarking, and CFOs have seen it, operations have seen it. And when they've dug deeper, there wasn't opportunities. And so we just have to really be careful of the tools and the metrics that we're utilizing, when the best way always is digging in deeper right from the beginning and not relying on a tidy metric that is really just a guesstimate. But my fear is that we're getting false negatives and false positives.